Our next living legend is Donna Diers. Donna Diers is the Annie W. Goodrich Professor Emerita and the lecturer in nursing at the Yale School of Nursing. She's also the Senior Clinical Coordinator, Decision Support for the Yale New Haven Health System. Additionally, Dr. Diers holds adjunct professor appointments at the University of Technology in Sydney, Australia, and the University of Sydney. And she also does quite a bit of work in New Zealand. She is retired. In the United States, Professor Diers is identified with the emergence of clinical nursing research methodologies, as she wrote the first book on that subject. She also is recognized for her work on policy and politics of advanced practice nursing. In Australia, her work with case mix, that is the application of AR-DRG type information for clinical practice and operational management, is particularly well known. Dr. Diers was the dean of the Yale School of Nursing from 1972 to 1985. Her publications have appeared in all major nursing journals in the United States and many journals in health services in the U.S. and Australia. Dr. Diers served as the editor of Image for the Journal of Nursing Scholarship for 8 years. She remains a manuscript reviewer for a number of professional journals in nursing and health services. A very popular public speaker, she also consults and teaches on writing for publication. Her book, Speaking of Nursing, Narratives of Practice, Research, and Policy and the Profession, received the AJN Book of the Year Award in 2005. We will now hear from Dr. Diers' sponsor, Dr. Margaret Gray.
Well, I've known Donna for almost 40 years. She was the dean when I was a master's student at the Yale School of Nursing, and she taught me my first research course. She has extraordinary passion for nursing. She is also a gifted writer and speaker, and speaks and writes with such passion about our field that it has inspired generations of young nurses to care about the field the way she cares about it. What I remember the most about Donna that encapsulates what passion she has for this field is her writing. She was for 8 years editor of what is now called the Journal of Nursing Scholarship, was then called Image, which was the journal of the Nursing Honorary Society. And her editorials were so incredibly pithy that you couldn't just pass them by as you read the journal. And I remember vividly an editorial she wrote about what do you say to people when they ask you why you didn't become a physician. And she asked for people to write those responses back to her, and later published another editorial with those responses, including my own response, which was, well, I don't know about you, but I'd rather have a smart nurse when I need one than a not as smart one. Well, I know there are many people who deserve this award, but I believe that Donna has occupied a very unique place in the last 30, 40, 50 years of our profession. She has not been afraid to say things that she knew would nudge people a little bit. And she has been inspirational and visionary about the roles that nursing and nurses could have in science, in primary care practice, and in understanding nursing outcomes. She's just an extraordinary woman.
Please join in applause while Dr. Diers joins me at the podium.
I became a nurse to be a good person, tall, clean, and confident, like my friend's mother up the street in her white starch. I found in nursing a cause. I never seriously wanted to be anything else, although I flirted with journalism until I realized I was far too shy to be an investigative reporter. But then I discovered in nursing I could use my love of writing and have something to write about. Part of nursing for me has always been the thrill of being behind the scenes, the fly on the wall, the stage manager, knowing the secrets of how the body, the mental mechanisms, healthcare operations work. I learned early on that I'm a much better understander and interpreter of nursing than I am a doer. I hit adulthood in the 60s at Yale. It was a time and the place where civil rights, women's rights, advocacy for social justice were palpable. I was where Virginia Henderson and Florence Wald were inventing the role of nursing science in the liberal arts university, the study of the work rather than the workers. Made sense to me. I didn't invent clinical nursing research. Robert Leonard and Florence and Virginia did. Bill Dickoff and Pat James gave us intellectual context. Rita Duma, Jean Johnson, Ada Sue Hinshaw, and way across the country, Ada Jaycox and Carol Lindemann, and then all our students fleshed it out. I, girl reporter, wrote it down, first under the beady editorial eye of Edith Patton Lewis, and I found a cause. Advanced practice nursing defined Yale's School of Nursing. I didn't invent it. Ida Gino Orlando and Ernestine Wiedenbach did, and later Margaret Arnstein brought in primary care. I, girl reporter, thought about it and wrote it down and made it another cause because the story of nursing's aspirations and opposition was irresistible. I didn't invent nursing for college graduates, but I will claim credit for stitching basic nursing into advanced practice, a model that simply suited Yale's history. And I thought about it and told the story. I wasn't even part of the original DRG research team. I came into that work after DRGs had already been implemented at the bleeding edge of public policy. I learned the possibility of administrative data for finding nursing. Now there is a cause. So I studied and thought about it and wrote about it as a grown-up data miner reporter. I've never had a mentor, but I've been the beneficiary of the generous sponsorship of many legends. These were and are the people who saw something in this little kid from Wyoming. Anna Baziak, my first nursing leader. Florence Wald, whose influence I learned too late to thank her enough. Bob Leonard, still a friend and correspondent. Rita Duma, in whose literal and metaphorical house I live. Faye Abdullah, Myrtle Kitchell Adelot, Rosella Schlotfeld, Ingeborg Mauch, Greta Stiles, Loretta Ford, and Vernice Ferguson, my heroines. In the writing game, Pat Lewis, Thelma Shore, Florence Downs, Lucy Kelly, Nell Watts. In leadership and audacity, Claire Fagan. Anna E. Ryle and Kit Knuckles shored up a very green dean. My three presidents at Yale, Kingman Brewster, Hannah Gray, Bart Giamatti, and Sam Chauncey, longtime university secretary. At Yale New Haven Hospital, Diana Weaver and Steve Allegretto. At many times, in many places, the incomparably generous Linda Aiken. She, Ruth McCorkle, Margaret Gray, and Ada Sue Hinshaw made this nomination happen. John Devereaux Thompson. My colleagues as teachers, Helen Varney Burst, Judy Krause, Diana Mason, Angie McBride, Martha Mitchell, Sally Cohen, Annette Flanagan, Vanita Mason, Barbara Seyfried, Lynn Price, and especially Susan Moldy. For sheer inspiration, no one beats Linda Spoonster Schwartz. My army of unnamed students and nurse colleagues keep me relevant. In Australia, Debbie Piccone, George Palmer, Chris Aisbeth, Jill White, Mary Chiarella, Amanda Adrian, Judith Donahue, Jackie Crisp, Christine Duffield, and especially Diane Pelche. In New Zealand, Frances Hughes, Jenny Carrier, Denise Wilson, Sue Wood, and Helen Snell. My family have never quite known what to do with me, but they made me and grew me. My parents, Don and Eileen, and their singular parents, Pop Diers and Grandma Ball. my brother Jim, his wife Jan, their son Ted, and his wife Carrie, and their children Nate and Ella, and my almost sisters, my Aunt Joanne and my cousin Sue. Guys out here and up there, I owe you. So I thank the Academy, a line I never thought I'd utter. For this improbable, sweet, and oddly healing honor. From me, now geezer storyteller, nurse.